Every person is different. It's because every individual is shaped by many different factors, such as genetics, education, the environment, experience, and relationships. Therefore, everyone develops their own subjective values, feelings, points of view, and lifestyle. It is important for a doctor to get an insight into their patient's background and inner lives to give the right diagnosis and to develop a customized therapy plan that also meets the patient's needs. To achieve this kind of treatment, there is an approach called person-centered care, short PCC. Person-centered care is about delivering care that is respectful and individualized, allowing negotiation of care and offering choice through a therapeutic relationship where persons are empowered to be involved in health decisions at whatever level is desired by that individual who is receiving the care. The difference between person-centered and patient-centered care is that person-centered care highlights the importance of knowing the person behind the patient as a human being with reasons, will, feelings, and needs in order to engage the person as an active partner in their care and treatment. A person-centered approach in practice depends on a partnership. In routine 1, you initiate the partnership. It's the patient's narrative. Invite the patient to tell their story about the illness and their unique situation. The patient's experiences, feelings, beliefs, and preferences are important. At this point, focus shifts from the disease to the person with the illness. Routine 2 is about working the partnership, which means shared decision-making. PCC starts with partnership building and includes sharing of information, shared deliberation, and shared decision-making. Involve the patient in the selection of tests and assessments. Agree on goals that are based on the patient's personal goals. At diagnosis, the care team, including the patient, should evaluate all aspects of management, taking into account treatment options that are suited to the patient's lifestyle, preferences, beliefs, values, and health issues. Routine 3 concentrates on safeguarding the partnership, hence documenting the narrative. Documenting patient preferences, beliefs, and values, as well as involvement in care and treatment decision-making and patient records, gives legitimacy to patient perspectives, makes the patient-provider interplay transparent, and facilitates continuity in care. The person's perspective is the patient's experience and its impact on them and caregivers, including symptomatic, intellectual, psychosocial, spiritual, and goal-oriented dimensions of the disease and its treatment. Challenges in the concept are how it can be effectively communicated, understood, and acted upon by others involved with the patient, including primary and subspecialty healthcare providers, adjunctive professional providers such as mental health and spiritual counselors, family and social network, and health-related influencers like government, insurers, and medical industry. The person perspective consists of ideas and beliefs why the disease happened and what caused it, concerns that are connected to the illness, expectations from the patient, family, and health service, and the effects on life, like on everyday tasks, the job, or the education. The person's perspective and the biomedical perspective are two parallel frameworks. Ideas and beliefs about possible causes face sequence of events. The concerns and feelings, the symptoms, and the expectations, the examination and reasoning. The effects on life equal the pathology, and the understanding and meaning of the illness, the diagnosis. The integration of these two frameworks is necessary for an accurate diagnosis and a basis for effective explanation and planning. What does support mean in relation to a patient? Treatment involves more than routine medical diagnosis, hospitalized care, or even the prescription of drugs. When confronted with illness, patients seek professional help and advice from their doctors, and also rely on support from family members, peers, and fellow patients. Support in relation to a patient's family means recognizing the importance of family members' roles in individual patients' healthcare experience, establishing relationships with and supporting patients and families, and helping patients discover how their own strengths and weaknesses influence their health and healthcare. When patients' needs are prioritized, they engage in treatment and the treatments are more effective. Considering all these factors can improve the clinical reasoning process, including the communication with the patients, the diagnosis, and the treatment and its effects.